Welcome back, health and wellness lovers. Once again, we meet here at Ask for Chi, this space for you to get verified facts about your health and wellness. I receive a lot of questions like, what's rosacea? What are the symptoms of rosacea? How to know if I have rosacea or something else? And how to treat rosacea. And for that reason, we're gonna be talking not to our friends, but to Emily, the owner of the Derm Expert and dermatologist certified nurse practitioner. They're so cute. So let's go find out. Hi, Emily. Thank you so much for taking the time today.
Thank you for having me.
Before we start, I would love for everyone to meet you. Can you tell us a little bit about you and what's your specialty?
Yes, so my name is Emily Brewer. I'm a nurse practitioner, board certified in dermatology. I've worked as a dermatology nurse practitioner for 12 years. I absolutely love it. It's the only specialty that I've ever worked in and all I plan to ever work in.
Nice. Today we're talking about rosacea. A lot of people ask me, what is rosacea?
So rosacea is an inflammatory disorder of the skin. It is characterized by facial redness. Occasionally you'll see some inflammatory bumps associated with it. It is a chronic progressive skin problem. There is unfortunately no cure for it, but there are many ways to help manage the problem.
And who could get rosacea and why? Are there any causes?
The cause is unknown. We don't really know why people get it, although there seems to be some hereditary variables that play into it, also some environmental variables that also play into the diagnosis, but it currently is unknown. We don't know why people get it. It does seem to affect more women than it does men, but in my practice, I treat men and women equally with it, but statistically more women are at risk of having rosacea than men.
What are the top symptoms of rosacea?
So facial redness is the most common, and it can be any part of the face, but predominantly the cheeks and the nose, the forehead and the chin are areas that I tend to see it most often. Small pus-filled bumps, typically on the cheeks and the nose. Again, can also be on the chin and the forehead as well. Over time, a lot of patients will start to see a thickening of the skin that can develop on the nose, and those are the most common symptoms that you see with rosacea. A lot of patients will describe a sensation of feeling like they almost have a fever in their face, an increase in warmth.
If someone is experiencing these symptoms and they know it might be rosacea, should it be treated?
So that's a good question. So rosacea is a benign skin problem. That being said, it doesn't require treatment. However, I would encourage to see a skincare specialist if they suspect that they do have rosacea, simply because there are other skin problems that can present physically in a similar way. The treatment's not required. You don't have to treat it. Knowing that it does not resolve without treatment and it doesn't resolve on its own, I do encourage patients to treat it because it does progress.
And in terms of treatment, what treatment would you recommend?
So that's very patient specific. So some patients that come in that have more mild symptoms, a lot of times it can be as simple as a prescription cleanser or a topical cream. The patients will come in and they have much more severe symptoms, certainly require a more systemic approach. It would be a pill that they would need to take. There are over-the-counter options that I think are a good starting point for patients with more mild symptoms. Anything with sulfur, so sulfur cleansers tend to be really useful for patients with rosacea. Azelaic acid is my personal favorite topical cream for rosacea. I use it personally and I think it works really well. And you can get it over the counter now. So those are my favorite over-the-counter options, but there are also prescription forms that can be used for rosacea.
One of the reasons I started this blog is because I started suffering from adult acne. I saw a lot of information out there. I took too long going into the doctor's office and getting my skin checked, and this caused me other problems. So in your expertise, why would be important to go see the doctor before even going to the pharmacy and maybe getting the treatment on your own?
So certainly to confirm that it is rosacea. There are problems such as lupus that will present on the skin with a very similar rash that you'll see across the nose and the cheeks that rosacea also has. So you would certainly want to make sure that you're dealing with a patient truly, in fact, with rosacea and not a larger problem along the lines of lupus.
And what would be an ideal skincare routine for patients with rosacea?
So definitely I would lean more toward gentle skin cleansers. So from an over-the-counter standpoint, I really recommend CeraVe cleanser or Cetaphil cleansers. Those are really good mild cleansers to use on your face. I also really like their moisturizer. So I tend to use CeraVe moisturizer personally. It's very lightweight. It doesn't feel heavy or occlusive on my skin. From a more treatment standpoint for the rosacea, I would go along the lines of a more sulfur-based cleanser if you're needing something more aggressive than just the gentle skin cleansers. And again, over-the-counter azelaic acid or prescription-strength azelaic acid, I think are phenomenal products for rosacea.
And what about toners? There's a lot of companies that sell like cleanser, toner, all other steps. Would you recommend having so many steps when you're having issues with your skin?
I would not, simply just because if your skin is really inflamed and you use something like a toner that tends to be very drying and irritating for your skin, you can actually make the problems worse, which patients with rosacea, a lot of women in particular, are wanting to do anti-aging treatments. They want to use prescription strength tretinoin or retin-A, or go down the road of chemical peels. Things along those lines for anti-aging treatment tend to make rosacea worse, just because anything that you're doing where you're going to be sloughing off the top layers of skin, you're going to make the redness more pronounced. And then also too, with rosacea, you tend to be a little bit more on the dry side anyway. Really drying product like a toner, or even from a more natural standpoint like tea tree oil or witch hazel, that tends to be very drying on the skin, and that can certainly cause a rosacea flare.
The last question that they sent me about rosacea was, can diet trigger or aid in any way this condition?
Absolutely, yes. So with rosacea, there are many triggers that patients will find that makes their rosacea flare. Foods definitely are on that list. There are certain foods such as spicy foods, very acidic foods, obviously drinks like red wine, that tends to be a trigger for a lot of people. Dairy being another common one. I tend to tell my patients to keep a journal. Every time I have a glass of red wine, I notice that I have a rosacea flare. I feel warm in my face, or I'll see the bumps appear. Sometimes simply just avoiding those triggers, that can be enough sometimes just to help manage the symptoms.
Sometimes when I drink a glass of red wine, I do get red in my cheeks. Like,
Absolutely.
Would that mean that I have rosacea?
It could potentially be a flare, yes.
Well, all this information was so amazing. In case anyone has a question for you or would like to connect with you, what would be the best way?
Through Instagram. It's at the @𝗵𝗡𝗥𝗟.
And right now you're doing telemedicine, right?
That's correct, yes. We can see patients from all over. So if there's someone outside of Tennessee, then we can certainly see those patients as well and tend to their skincare needs.
Perfect, perfect. All right, Emily, thank you so much once again.
Hey, good to see you. Take care.
Of course, I can't leave without showing you this. Wild nature in Florida.